Slipped upper femoral epiphysis. In slipped upper femoral epiphysis, the key points to remember are: the patient will be 11 to 15-year-old boy. There will be limping. The affected leg is shorter than the other. Externally rotated hip that increases with hip flexion. Painful knee, hip, thigh and groin. And there will be limited hip abduction. So, again, in slipped upper femoral epiphysis, the patient will be 11 to 15-year-old boy. There will be limping. Affected leg is shorter than the other. Externally rotated hip that increases with hip flexion. There will be painful knee, hip, thigh and groin. And there will be limited hip abduction. Now, let us understand the structure of a long bone. A long bone is divided into three parts. Epiphysis, which is the end of a long bone. Diaphysis, which is the midsection or shaft of a long bone. Metaphysis, which is the portion of a long bone between the epiphysis and diaphysis. So that means a long bone has two epiphysis, two metaphysis and a diaphysis. Epiphysis is the rounded end of a long bone. Its main job is to form joints with the adjacent bones. The epiphysis is covered by articulate cartilage at the joint. Subchondral bone is the bone below the articulate cartilage and its growth plate. Epiphysis is made up of spongy bone known as trabecular bone. The main functional unit of this type of bone tissue is called trabecula, which forms a structural framework of the bone. The space between the trabeculae contains red bone marrow, which undergoes hematopoiesis. Osteoblasts surrounding the epiphysis convert spongy bone to compact bone. Compact bone is also known as cortical bone. Metaphysis contains growth plate of the epiphysis, which is also known as epiphyseal growth plate. The outer layer of the diaphysis is made up of cortical bone. This cortical bone is a dense and hard type of bone tissue, but the medullary cavity of the diaphysis contains yellow bone marrow. In epiphysis there is red bone marrow and in diaphysis there is yellow bone marrow. The main functional unit of the compact or cortical bone is the osteon. An osteon contains a central canal called Haversian canal. Blood vessels, lymphatic vessels and nerves pass through this central canal. Each osteon is a compact cylinder of concentric lamellae. The only cells in an osteon are the osteocytes that are found on the edges of each lamella. Osteocytes are embedded in lacunae. Lacunae are empty spaces for the osteocytes to sit in and be protected from crushing. Cytoplasmic extensions branch out from each osteocyte and are housed in canaliculi. These canaliculi are actually thin empty spaces or channels. So now let's return back to the topic. Slipped upper femoral epiphysis. Slipped upper femoral epiphysis is also known as slipped capital femoral epiphysis. Slipped capital femoral epiphysis or slipped upper femoral epiphysis is actually a fracture through the growth plate, which causes slippage of the overlying end of femoral metaphysis. Let's make it more simpler. It's a fracture through the growth plate which causes slippage of the epiphysis. It presents as pain or discomfort in the groin or knee, common in obese adolescent boys, and there will be limping on the affected side. Remember the mnemonic SUFE, where S is for shortening of the limb, U is for unable to abduct, F is for flexed hip, which rotates externally, and E is for external rotation of the hip. What is the choice of investigation here? The choice of investigation in slipped upper femoral epiphysis is X-ray in frog leg position. Why in frog leg position? Because X-ray in frog leg position shows the widening of the epiphyseal line or displacement of the femoral head. How will you manage slipped upper femoral epiphysis? Through surgical fixation. Surgical fixation through the growth plate is done to manage slipped upper femoral epiphysis. Remember, slipped upper femoral epiphysis is also called as slipped capital femoral epiphysis.